Hi, I'm Dr. Christopher Trinh. Today we're going to be talking about tooth extraction. Why do patients need extraction? There are a couple of reasons. One is the tooth is severely decayed where it's no longer possible to restore. Another reason is when the tooth has severe periodontal disease, meaning the supporting structures around the tooth, which include the gum, the bone is so badly infected that it's deteriorated to a point where there's no support around the tooth. The tooth might look fine clinically, but it's really loose, it's really mobile. So that's when it's no longer possible to save. So those are the main reasons for tooth extraction. One is the tooth is severely decayed. Two is periodontal disease. Okay. Now there are different types of extraction. There are simple extraction and there are surgical extraction. Simple extraction is usually, let's say you have severe periodontal disease, there's no more supporting structures around the tooth, so the tooth is really loose, right? So that we can easily go in there, use a forceps, a tooth forceps. We grab a hold of a tooth and we just pull it out, and that come out very easily without any complication. There's no cutting. So that scenario is a simple extraction. Now, the more involved is a surgical extraction. And when do we need to do a surgical procedure? It's usually when a tooth is really severely decayed or broken down to at the gum level or below the gum level. We have no way of grabbing on the tooth. Let's say this is the crown sticking above the gum, and this part is the root, is encased within the bone. So there's nothing left here. So then the root is at the gum level, so we don't have anything to grab a hold of, right? So what do we do? How do we get the tooth out, right? So naturally, patient is going to be numb, right? And we make an incision into the gum around the tooth, around the root, or whatever remaining tooth structure we have left, and we retract or we pull back the gum. Now we expose part of the bone that's supporting or surrounding the tooth, and then we use a drill, and then we kind of remove a little bit of bone surrounding the root or the remaining tooth structure that's left. So once we expose part of the remaining tooth that we think we can grab a hold of, we use what we call an elevator. It's an instrument where we use to wedge between the tooth, the remaining tooth, and the bone to make it loose, to loosen it up. So an elevator, the term elevator is just correspond to, we elevate, we try to go in there, loosen the tooth or the remaining tooth structure and elevate it and elevate that remaining tooth structure out of a socket. So once that's loose, then we use a tooth forceps. We go in and we grab, whatever part of the tooth that we were able to expose, and then we lift it out of the socket. So in that case, that's a surgical extraction. And then once we lift it out of the socket, now what we do is we can preserve the socket by putting bone in there, and then we suture it up. So that's usually what we call surgical extraction. Earlier we talked about why do a tooth needs to be pulled. Now we're going to talk about there are different types of extraction. There's one that's simple extraction and the other one is surgical extraction. What is simple extraction? The simple extraction is when the tooth is so easily can be removed without, much surgery. It's usually involved, let's say the tooth has periodontal disease where it's very mobile. So that's something that we can just grab a hold of it with a dental forceps and then just remove it from the socket. Of course, before we pulling, we go and pull any teeth, we're gonna have to numb you, right? You're gonna be comfortably numb before we would try to go in there and pull the tooth. We're not gonna pull the tooth without numbing you, all right? Now, another type of pulling tooth or tooth extraction is surgical procedure. And when do we need to do surgical extraction? It's usually when the tooth is broken down below the gum line, or or a severely decay where we cannot grab a hold of the tooth with a dental forceps, right? Because there's nothing there, right? So let's say this is a gum level. So the part of the tooth is really sticking above the gum is gone, or it's so soft, like anytime we grab a hold of it, it just crumble, right? So now what do we do, right? But the root inside the bone is solid. So how do we get the remaining two structures out of the socket? Of course, again, we're gonna need to numb you. Once you're completely and comfortably numb, we make an incision along the gum. Let's say this is the gum. We make an incision. We pull the gum back, right? So now the remaining two structure and the bone that's encasing the remaining two structures is exposed. So once that's exposed, we get a drill. We remove, the surrounding bone. Let's say it's right here. Now we remove it, surrounding it to where it's below part of the remaining tooth structure. Now part of it is exposed. Then we use an elevator or dental instrument to loosen up the root. So first it's solid. So we try to luxate it, elevate it. So once it becomes loose, then we use the dental forceps and we grab the part of the tooth that is exposed. After removing the bone, then we just lift it out of the socket. Okay, that's it. And then what do we do after the tooth is removed? Okay, so that part where we talk about making incision of the gum, removing bone, getting the tooth out, that's surgical procedure. Now, what do we do after the tooth is removed from the socket, whether it's simple or surgical? Do we just leave it like that, or, we try to do something with the hole? So there's a procedure we call socket preservation. What is socket preservation? It is meaning we fill up the hole or the socket, the empty socket, with bone. We put artificial bone, cadaver bone, into the socket, right? And then we usually cover it with a membrane or some kind of gel foam, and then we suture it up for 10 days. And we bring you back and we check to make sure everything is okay. If the gum, everything's sealed up nicely, then we go ahead and remove the suture. There's different type of suture. There's resorbable and there's non-resorbable. Of course, the resorbable, which is living in there, it will resolve on its own. The non-resorbable, we just go in and remove the stitches, okay? Now, what is the purpose of bone graft or socket preservation? The purpose of it is, let's say you want to get an implant down the line, right? Or you want to get dentures. So by having bones in there, it kind of maintains the bone level that is there. So later on, when you put an implants in, right, the more bones you have, the more density you have, right? Just think of it like an anchor, right? You don't want to put an anchor into the ground where it's muddy and it's not solid cement. So with the bones there, think of it like it's more solid, right? So you put an anchor, an implant, a screw in there, it tends to stay in there much better than not having anything. Also, let's say you want to get dentures down the line without bone graft or socket preservation, that area, that hole is empty, right? So bones around that area tend to resorb a lot faster. So just imagine this is your bone and this is your denture. The more bone you have, right, it's not going to move so much. But then if you don't have any bone and it's just flat, your denture is going to float around. So think of it that way. So that's why we recommend socket preservation when we do tooth extraction. Keep in mind, this is something that I do for my own family. My older brother, sister, when I pull the teeth, I bone graft every single time. That is allowed. That the socket, the walls there, I bone graft every single one of them. I myself have cracked tooth and had tooth extraction and had implant. I had bone graft in my own mouth. So I totally believe in it. I think it's great. Is there a problem? Very rarely does I see the bone graft. I think maybe over decades of practicing, I think maybe 1, 2. And why does it cause that? Honestly, we're not God, so everybody react differently. So everybody's body's different. So, and what do we do? Let's say if the bone doesn't take, well, we go in there, we numb you up, we clean it out, we leave it alone. We put, some medications in there, we just let it be, and we follow up your 24 hours. But that situation, that scenario is like maybe once or twice compared to I don't know, we did hundreds, thousands, I don't know. I mean, it's just so rare that it ever happened. So usually with bone graft site preservation, we usually cover patient with antibiotics to prevent infection. With that say, extraction, what do you do after the extraction, bone graft, or you don't have to, you don't want to, it's just something that we highly recommend because it works. But also the advantage of having bone graft or site preservation, imagine you take the tooth out and there's a hole there. You eat whatever you put in your mouth potentially could get into that hole, and that can cause infections, right? Or delay healing. With the bone graft and then the membranes and then with sutures it up, it's almost impossible for anything to get in there. Nothing in life is 100% guaranteed. But like I said, we do so much of it that, I have it myself, my oldest sibling have it. So that's a little preview about, or information about tooth extraction and bone graft, all right? What to do after appointment of extraction. After you have your tooth pulled, what do you do? Patients usually ask, what can I do? What can I eat? Things in that nature. Usually after the extraction, we usually give patient oral instruction verbally, and then we also give patient a written instruction to take home with, along with some sterile gauze, just in case there's prolonged bleeding. Usually that doesn't really happen. It's really rare if that ever occur. With that say, let's say after you have your tooth or teeth pulled, we usually give you a prescription for antibiotics if you have infection or existing infection, and then also prescription for pain meds. It's usually non-narcotic. We don't really prescribe narcotics anymore due to the drug abuse that's going on around. Now, with that say, what do we do, right? I mean, what do patient can do after the extraction? What can they eat? We usually advise patient no smoking, no drinking alcohol for several days. Don't play with your tongue. Don't put your tongue up where the extraction site is, especially if the suture's there. We don't want the sutures to come loose. We advise patient not to suck a straw, not to forcibly spit. If you want to spit, just kind of lean over, use your tongue to push out the saliva. The reason for that is we don't want to displace the blood clot, right? We want the blood clot to form so the bleeding will stop. Also, we ask patient not to rinse or brush at the extraction site on the day of. Same reason is so that you don't displace the blood clot. All right, as far as its eating goes, we advise patient, something light, liquid or mashed potato, nothing sharp like chips, anything like that, that can poke the, or, displace the suture. So just pretty much soft diet. And then 24 hours after, we advise patient to rinse with warm and salt water. Now, in case if there a lot of bleeding, sometimes we advise patient to bite on a tea bag. That usually help with control the bleeding. But on the written instruction, post-op instruction, there's also a contact number that you can reach out to either myself or Dr. Pham, and we'll call you back and try to address any concern or things that happen out of ordinary. Okay, as far as that go, that's about it. Nothing really major. Now, usually also, just in case, let's say you have excruciating pain, we advise patient to give us a call right away. Any type of concern, doesn't matter what times, you can call or text, and let us know. We usually follow up with a post-op call, to make sure you're doing okay. Sometimes patient doesn't really want to talk for obvious reason. They just have the tooth or teeth pull, so we'll text them as well, just to make sure that they're doing okay. All right. But other than that, for patient that smoke, I strongly suggest that you don't smoke before and after the extraction. The reason why is you're at high risk for a dry socket. If you have a dry socket, it's not fun. We will have to numb you up, and sometimes it's hard to get numb. And then once you're numb, we're gonna have to go in there and correct the socket. So I have to scrape the bone to allow the bone to bleed, so that it will bring nutrients and help heal the socket. And of course, we're gonna put in dry socket paste with the gauze, and then we sutures it up, and we'll follow up with you every 24 hours until the pain goes away. How do you know have a dry socket? Usually it occurs about 3 days or so. All of a sudden you have excruciating pain, just shot up 3 days after, 2-3 days after, it really depends. So that's usually indication of a dry socket. And then, like I said, what do we do with that? And I just explained. We bring you in, we numb you up. We have to scrape the bone, correct the socket, and put dry socket paste in there, sutures it up, and follow up with you 24 hours after. So, strong advice. Highly recommended, do not smoke or drink alcohol. Okay? All right. You have any further question, anything you might be concerned with, please reach out to me at 702-456-0056. Have a great day. Thank you. Bye-bye.